Thank you, Hindi team. Now it is the time for the English session, not the session. Now today we are celebrating our 300 days of continuous webinar. Thank you all the participants and welcome everyone to today's session. Actually, IFPH started its journey before 1300 days. Now also, it's a never-ending journey. And every day we are getting new co-travelers and we are continuing our journey. I'm not talking much about IFPH. All of you are aware about IFPH. Even though when we are celebrating, just I'm telling few words of IFPH. But we have, in English session, we have celebration. Likewise, in Malayalam session also, we have celebration. So we have to hand over within 1 hour. That's why I'm cut short the introduction because all of you are our co-travelers. So welcome everyone. And for the prayer song, I'm inviting Mr. Madhav Pillai. Mr. or Master, I don't know. Madhav Pillai from US, please. Madhav.
Yes, Madhav.
Good evening. My name is Madhav.
Okay.
I'll be speaking here by Joshua.
Yes, you can start now. Madhav.
When I am down and oh my soul so weary, when troubles come and my heart burdened be, then I am still and wait here in the silence until you come and sit a while with me. You raise me up so I can stand on mountains. You raise me up to walk on stormy seas. I am strong when I am on your shoulders. You raise me up to more than I can be. Thank you.
Thank you, Mohan. And now I'm inviting Dr. Ismail Seth, the president of IFPH, for inaugurating the program.
Doctor, welcome. First, welcome speech, then inauguration.
Okay.
Shah will join shortly.
Oh. No, Dr. Shaji Kudiat sir already he joined.
No. Welcome speech by Dr. Shaji Kudiat.
Sorry. Sir, please.
Yeah, who is sharing the, can you remove the sharing?
What?
Somebody is sharing the screen.
Who is sharing? I cannot see anything.
No screen sharing, doctor. You can, you are not co-host. Please make Shaji Kudiat co-host, then only he can share. Please
okay. No, I am not sharing. Okay.
No, he want to screen. Screen sharing, is it?
Okay, thank you very much. Today, IUPH is entering another very important landmark achievement of 1,300 days of continuous uninterrupted Zoom meeting, which has started nearly 4 years ago at the time of pandemic. When the whole world stands still, we few homeopathy doctors and lovers started this forum to promote homeopathy as one of the best preventive treatment and rehabilitative medicine for viral infections. Now the relevance and scope of homeopathy remains at par in the post-COVID scenario. So we will be talking about that. Today I am vested with the two important responsibilities. One is to welcome all the dignitaries for this historically important function, and also to present the topic of the relevance of homeopathy post-COVID scenario in the world. So I'll first fulfill my responsibility of welcoming you all. I first and foremost invite and welcome the very own Honorable President of International Forum for Promoting Homeopathy, Dr. Ismail Said Sir, who is one of the senior most and most respected homeopathy doctors, I will say, living in India and the world. Totally dedicated, passionately, the entire life in service to mankind through homeopathy. Very passionately still, running, jumping, and traveling anywhere if homeopathy needs. I wholeheartedly welcome Dr. Ismail Said Sir to these 1,300 day celebrations. Another most important person is Dr. M.K. Sahani Sir, who is our keynote speaker today. He is one of the senior most and most respected homeopathy doctors, not only in India, but in the world. And we are proud to have him host our Hindi program since its inception. And Dr. Sahani Sir will be giving the keynote address regarding the post-COVID scenario and homeopathy. And Doctor will be organizing an international seminar in next January 2025. Now itself, I am inviting on behalf of the organizers, where IUPH is also part of organizing team, and invite all of you to come to Patna in Bihar, India, to participate in that international event. I wholeheartedly invite Dr. M.K. Sahani Sir as the keynote speaker of this very important function of 1,300 day celebrations. I also welcome the felicitation speakers, Dr. Nigunj Trivedi from United Kingdom, Dr. Ilahi Bucks from Pakistan, Dr. Huang Wheeling, my friend whom I met long back in Australia, Dr. Marian Salcedo from Bolivia, who is the South American coordinator also, and also for Bolivia, doing wonderful job. Actually, I'm coming just after a university post-graduation celebration of experts for homeopathy course started in a university in South America with the efforts of Dr. Marian. It is IUPH is a very important part of that inspiration for Dr. Marian and others to come out to start that course. It is running very good now. And Dr. Muhammad Abdul Majid, Pakistan, from Bangladesh, sorry, who also organized many international events, and I am also used to be one of his guests to Bangladesh. And also Dr. Bob Lim from Malaysia, very regular participant and associate of coordinator for Malaysia also. So I invite all the felicitation speakers from different countries around the world for this important function of 1,300 days. Then I welcome Dr. T.P. Anil Kumar, who is our own treasurer, who will be saying the vote of thanks, and also the moderators, Dr. Ajini and Dr. Danesh, who are always playing very important, wonderful job for the continuation of this program. And I also invite wholeheartedly all those who are present today in this important celebration, playing roles in various ways associated with the IUPH. So I welcome you all. Thank you. My second responsibility is to give an introduction to the topic in the post-COVID scenario. So when we look into the post-COVID scenario, very important things happen. And the most important thing is homeopathy became an unavoidable medicine in the post-COVID scenario in the world. The only scope for prevention, treatment, and rehabilitation of viral infections and many other diseases are possible with the homeopathy as the main tool. And we can all be proud as homeopathy doctors. It is not only acting as preventive treatment and rehabilitation, even in overcoming the side effects of the COVID vaccination, unproven vaccinations in the name of mRNA vaccine they are giving. We have tools to prevent the side effect and overcome the side effects. Again, homeopathy become an unavoidable medication in the post-COVID scenario, which we can be proud of. But we need to tell to the world so that suffering people can make use of it. So that we can further widen the scope and possibility of homeopathy in the world. So it is the noise and communication that we make, which nobody else will support us, that makes homeopathy beneficial to humanity. And also, homeopathy is going to become the most potential medicine for the furtherance of science. Because the present science is linear science or material science, which is not able to explain even the explanation of how we exist as a living being, how the mind, vital force, and body are interconnected. The science we use in medical world today is just study only the physical plane. They don't incorporate the influence and impact of the mind and the vital force in the physical body. That is very important. So the coming few years are going to become very important, crucial transformation of the entire science, especially medical science. And homeopathy is going to become the gateway for the furtherance of science from linear or material science to holistic or non-linear science. So the scope of homeopathy in every way is tremendous, and we can all be proud of that. And IFPH, International Forum for Promoting Homeopathy, as an international institution and organization, is going to play very crucial, important roles in all these transformations and achievements that we need to make for the beneficial implication and use of homeopathy and for the healthy existence of humanity at large. So with these words, I wind up. Wish you all the greetings of 1,300 days of continuous existence and historically important webinars being conducted by IFPH and all the team who is working behind it. Thank you very much.
Thank you, sir. Thank you so much. And now I am inviting Dr. Ismail Said for inaugurating our function. He is the president of IFPH, and I'm inviting the young smart boy of IFPH. Please welcome. Sir.
Unmute. I'm very happy this day. Without any interruption, we passed on 1,300 days. And I am very happy to see you all in this occasion for presenting these IFPH's programs every day without any break. The mails also coming in, sharing the experience and everything. Now, this day is very, very important because we are going to pass the even 2,000 or 3,000 days of interrupted seminars, interrupted meetings under the IFPH. I'm very hopeful because 1,300 is gone without any difficulty. Very easy to go. Okay. As we are pulling this one thread from the butter, that much smooth is running away. So I'm happy in this occasion and not telling too much comments because very, very important persons are sitting there, sharing everything. I'm very much glad that Dr. Gurana is going to conduct a meeting and in the memory of his father and Patna. Surely, we almost all members of the IUP will be present there. We will give our presence in this Patna. Surely. Sure. So, this occasion, I'm not going to take much time this way. Dr. Shaji has given very, very important roles in the homeopathy. Homeopathy, we can treat everything if they're getting any symptoms. Today also I got so many cases in the rectal cancer and renal failure, 2 types of renal failure, everything we given medicines. Last month, we also given the medicine, they are all getting improvement. So I am very sure that with homeopathy, we can do wonders in the field of medical science. So, this occasion, I not take much time to elevate the lecture. I'm humbly inaugurating this occasion with a proud and respect. I'm inaugurating this section, 1,300 days of IUP meeting. Thank you very much.
Thank you, sir. Now I am inviting Dr. Mritul Sahani, sir, for a keynote address. Sir, please.
Thank you, Dr. Anjali, and my respected Dr. Ismail Seth, sir, our president of the IFPH, Dr. Saji Kudyat, and all the participants, as well as the dignitaries who are present today here with the to be felicitated today. And I feel proud to be the part of this wonderful, unique session which is being continued uninterruptedly, and now it has reached the 1300 days. And I feel and I pray that it should be an everlasting journey for all of us. Friends, today being the 1300 and the topic and the theme has been very nicely chosen to have an introspection about the post-COVID scenario and the homeopathy. And for this, I would like to start my view with the Mr. Marie Curie, Nobel Prize winner. Nothing in life is to be feared. It is only to be understood. Now is the time to understand more so that we may fear less. And with this, now that the scenario is that now the COVID-19 pandemic has become a part of the history, leaving behind many unanswered questions, a new challenges for coming generations to face and find a solution. Many people who has been taken as a fully recovered, but current evidence suggests that approximately 10 to 20% people experience a variety of mild and long-term effects after the recovery of their illness. Although our current understanding of cause of post-COVID and why some people are more affected. And of course, the last two years COVID pandemic has become a challenge healthcare system across the globe. And to deal with the absence of specific treatment of protocol for COVID, collective efforts were required from the medical systems existing in India, including both the modern. Dr. Sajid Kudiat has nicely mentioned about the homeopathy being emerging as a system which cannot be replaced, cannot be removed. So several studies suggest that classical homeopathy was associated with the improvement in COVID, including severe cases despite limitations from study design and data sources. Our findings should prompt further study role of classical homeopathy in the management of COVID-19 post-COVID effect. Now, this post-COVID conditions has been nicknamed as long hauler. Long hauler has been nicknamed for this, and common symptoms are related. I think I could give you the details in the common symptoms. Only that the responsibility and the things that is to be faced is very important. The adaptive measures are important, and we have to learn about the adaptive measures. And homeopathy is suggested to be useful, boosting the immunological response in various conditions, and can thus be used as adjuvant tool to fight against the tool in their sequence. Large number of medicines are mentioned. Large number of the medicines are mentioned in the our repertory and the Metra Medica. I'm selecting the medicines in the name of the disease. Is not. We should. I think this is the uniqueness of the homeopathic system of the medicines, that we don't do the medicines on the basis of the name of the disease. The patient-oriented treatment is important, and totality of the symptoms is more important. Totality of the symptoms, and in this context, now what is the challenge? What is the required now? The most required things are that to produce a evidence-based study in the homeopathy. And this is the major challenge for the homeopathic physicians, where we are lacking. And we are treating, I know, no doubt, everyone present in this webinar, they must have experienced the benefit and the changes that is there with the post-COVID effects. But the world is not going to accept that. They need some evidence, concrete understanding about that, and this is a unique thing that. And in this regard, we have to work hard to make it, because to make the understanding about the conditions to be understood by the scientific arena. So homeopathy has been a matter of discussions among all. We all had been talking about the homeopathy is fake, homeopathy does and that. So many controversial views are there. I see. Without blaming others, I should blame ourselves. We have to present ourselves. We have to instead of looking at about the criticism, we must have an introspection about what we are doing, what we actually are doing. So clinical evidences are important, and I can tell you there are many evidences which has been started pouring into the peer-reviewed journal. One of the important articles that was published in Indian Journal of Research in Homeopathy by Central Council for Research in Homeopathy. They have randomized controlled trials to compare the efficacy of the homeopathy in combinations with the homeopathic treatment with the post-COVID cases of the and 19 cases were undertaken, and out of that all recovered well. This is the reported and documented case. Then another, this is the official recognitions. I say this is the official recognition, very important thing for the COVID. So empirical evidences, as evidences are required, and there must be a major understanding to know that to follow all our brothers, all our friends and all homeopaths who are engaged, who are practicing, irrespective of the COVID or any other system of any other disease, they should go for the evidence-based practice. This is the way that we can make, instead of saying and crying that we are the best, we are the best, it is where we have to show them that this is this is the reality, this is the fact, and the government are recognizing these facts. This is important thing, and I feel I should not continue more because many others will have to speak today, and I am glad that we have taken this, chosen this theme topic for this 1300 day celebration. And thank you all for my
Thank you, sir. Thank you so much. And now I'm inviting Dr. Nikunj Trivedi from UK for felicitation. Sir, please. Dr. Nikunj Trivedi.
Hello.
Okay.
Jai Hanuman, Jai Homeopathy. Today is 1300th day of uninterrupted, continuous webinar from IFPH, and I feel proud to be a part of that. I would like to share my screen just to give some glimpses about the post-COVID impact on patient's life and our life. So here I'll take your permission to share my screen, please.
Yes, sir, you can share the screen.
Are you able to see?
Yes, sir, we can see.
So first of all, I heartiest congratulating to IAPH on 13th 1300th day celebration of uninterrupted webinar, and which has really made a difference across the globe to all the homeopaths by enriching the treasure of knowledge. And here I must say that imagine a world in which homeopathy is universally accepted as a potent part of everyday life. And whatever Dr. Hahnemann wrote in Organon of Medicine, if the physician clearly perceive what is to be cured in diseases, in every individual case of disease, and that we call the knowledge of disease. If he clearly perceive what is curative in medicine in each individual medicine, we call the knowledge of medicine or medicinal power. And if he knows how to adapt according to clearly defined principles, what is curative in medicines to what he has to discover to be undoubtedly morbid in the patient, so that the recovery must ensure to adopt it. So during the phase of COVID, we applied our homeopathic knowledge to cure the symptoms of our patients in a various way. Some adopted classical way, some adopted polytherapy, but we tried our level best to help our patients to best of way to restore them for the recovery. So now coming to the post-COVID complication, patient land up with long COVID, and that long COVID general symptoms with people, patients, they have developed a tiredness or fatigue, which interferes with daily life. All the time, when patient comes to the clinic, they complain that I am feeling tired, I am feeling bored, I am feeling weak, I don't have motivation, I don't have enthusiasm. This is post-COVID complication. And if we look in the Baraita curve, there is a one rubric, there is a one symptoms, there is NUI tedium. This should be considered when patient is complaining of the tiredness or fatigue and which interferes with his day-to-day routine life. Another symptom is post-exertional malaise. Any mental or physical exertion makes patient to feel tired, bored, lethargic, indolent. And this rubric, these symptoms, we can find with so many medicine, but the lachesis is the best medicine. And I have tried lachesis to many patients when patient is indolent. Habitual laziness to be ruled out with the help of our homeopathic medicine. No doubt constitution, myism is very, very important. And we have to take that thing into consideration. But these are the long COVID general symptoms that we have evaluated. Now, we are coming to the post-COVID respiratory symptoms. Many patients having a dry cough, dyspnea on exertion, dyspnea at rest, chest pain, tachypnea, breathlessness, and palpitation. Symptomatology and considering the patient as a whole, dyspnea on exertion with cough, with chest pain. When we check the SpO2 level, and when the SpO2 level shows low, the best medicine which I am using in my practice is carbo-veg, and which is marvelously increasing the oxygen carrying capacity in my patient, and patients are feeling better, and seeing is believing. I always believe in documentation. I always believe to show that document to our colleagues, allopaths, and that's why they have started believing in homeopathy. So when I administer carbo-veg to my patients with a dyspnea, with a cough, with a chest pain, and when there is a bluish nails, carbo-veg is giving a marvelous result. And this is post-COVID respiratory symptoms, a small, simple example that I'm giving from my practice. Post-COVID digestive symptoms comes with the diarrhea and abdominal pain. COVID and the preventive measures for COVID, that the vaccine has been taken by the patient, which is affecting the DNA level. And then it is affecting the intestinal flora. It changes the intestinal flora, and patient is landing up with the diarrhea. Arsenicum is very well known, and everybody knows about the arsenicum album in India and in Western country as well, because during the disastrous time of COVID, it has been distributed widely all over the globe. So diarrhea has been coming under control with the help of arsenicum album. And with the abdominal pain, symptomatically, I am using Magfos, Colocin, Dioscoria as per patient's clinical picture. Post-COVID, other symptoms, joint or muscle pain.
Sir,
Yes.
I think we will have a session about this in another.
Yeah, I know it's 7 minutes given, and just I'm finishing within 2 slides.
Okay, thanks.
Joint or muscle pain, skin rash, changes in menstrual cycle, postmenopausal bleeding, low libido, low sperm count, and skin fungal infection. Every day I am getting 3 to 4 patients having a fungal infection. Actually, I was surprised that it's a fungal epidemic after COVID, and that has been treated very wisely, very nicely with the help of antifungal homeopathic remedies like Sapia. Post-COVID neurological symptoms, as you know very well, that depression, anxiety, mental health issue, brain fog, cognitive impairment, everything you know, weakness of limbs and tremors. And only this neurological manifestations. In gait, you can see with only one simple slide that how patient can recover in a span of 2 weeks with the help of Costicum. This patient visited me on 1st of April 2022. Patient was unable to walk independently. Patient has to take support. There was a quite limping. In the same patient, improvement in gait noted on 13th of April. So this is the magic of homeopathy. If well-selected remedy has been given to the patient, we can make a very good change in quality of life of the patient and rule out the obstacles to the cure by CBC with laboratory investigations by doing CBC, liver function test, renal function test, lactose, lactate dehydrogenase, C-reactive protein, and CAT scan of the chest. And how to overcome post-COVID manifestation by selection of constitutional remedy, preventive, immunobooster, and prophylactic remedies from the Materia Medica. And this is my protocol. This is symptomology with specific clinical examination, which is very, very essential. That's what I consider in my practice. And then I can restore the abnormal pathology to the normal physiology. And this is all about post-COVID complications. And thank you very much for listening to me. Thanks.
Thank you so much, sir. And now I am inviting Dr. Ilahi Bucks from Pakistan. Sir, please.
Good evening. I am audible.
Sir, please.
Am I audible?
Yes,
Am I
sir.
audible?
Yes, sir.
Okay. Okay. Today, the 23rd March is not only the one occasion, but for me, it is a dual occasion. One is 1,300 continuous session of IPH, and second one is my birthday, 64th birthday. This is the second occasion. So I am very proud of them. I am honored to be part of the 1,300 session of the IPH, which is uninterrupted and continuous one. That is a good and very marvelous thing and unbelievable thing in this event. Because this forum is a global forum and we wish to share our post-COVID scenario comments. I just commented that in post-COVID scenario or in post-COVID days, in my practice, certain things I have observed that the disease pattern has been changed. So many diseases have atypical signs and symptoms according to medicine or internal medicine, which has been changed during these days. We have seen that the increase in the diabetes exploration has been observed. So far as the day-to-day symptoms I have observed in my practice is the top one is the forgetfulness, loss of memory, especially the short-term memory. I have observed in my patients that post-COVID, that is, I think that it is belongs to post-COVID symptoms or post-COVID things, post-COVID effect. whether it may be due to vaccination or whether it is due to the infection. But as a long corona or long COVID, I can say that the 3 or 4 things which I have been observed in my clinic is diarrhea. This it's a spontaneous and very immediate watery diarrhea I have been observed in these people, and muscular pain and fatigue, which has already described my successor one. And these symptoms, I think that very efficiently being controlled and very efficiently being tackled by the homeopathy, because the people came to me are not the have the first visit to me, but they first adopt the allopathy and go to the concerned specialist and consultant. Then they see that they are unsuccessfully uh, treating the diseases, then they consult the homeopath. And people who came to me, I have seen that within 3 to 2 days, if the medicine is true and correctly choice, I see that they have magically cured and they have magically given the good result. The post-COVID scenario, as I have been given the 5 minutes and I am completing as soon as possible. Okay, I can say that it is homeopathy is the more important system of medicine can be considered as compared to pre-COVID and during COVID. It is more effective in the post-COVID arena, and that is all from my side for the 1,300 IPH live sessions. Thank you.
Thank you, sir, and happy birthday and many more happy returns of the day on behalf of IFPH. And now we have 4 more participants for felicitation. And so I'm welcoming Dr. Huang Wei Ling from Brazil. Doctor, please. I think
You're allowed to share the screen.
You have 3 minutes.
Okay, I'm
Okay, madam, you can start.
I don't know where is my data show. Okay, I will not share the screen. Good morning to everyone. My name is Huang Wei Ling. I'm from Brazil. I'm very happy to be here today in this meeting to celebrate the 1,300 days of IFPH program. I also would like to thank all the group, all the medical doctors, Dr. Saji, Dr. Ismail, and all the countries that are participating in this IFPH program. I would like to say that in Brazil, we are still having so many cases of COVID-19, even after the massive vaccination. But what I would like to say is that we are still not doing the diagnosis in the energy level that we needed to understand that all the manifestations in COVID-19 and all the post-COVID manifestation is caused by this energy deficiency situation that the majority of the population globally is suffering nowadays. So we are facing a kind of immune deficiency caused by this energy deficiency situation, and the massive vaccination is worsening this energy deficiency situation, leading to increasing cases of cancer or metastases in patients that received this vaccination and are having autoimmune disease, diabetes, myocardial infarction, strokes, etc. And we are facing another phase of post-COVID-19 that is we need to treat all the disease that we are facing after this mass vaccination. So we need to understand that we need to increase our immune system, and the only medication that we can use nowadays due to this energy deficiency is to use high diluted medication. And the only medication that we can use nowadays is homeopathy, because when we use high concentrate medication, this energy will reduce even more and will cause complications or even death of our patients. So we need to fight, continue to fight, and hold our hands to increase our power to disseminate this knowledge. And I know that one day we will see that homeopathy will be the first medication prescribed globally. Thank you for your attention, and I will give another talk next month. Thank you.
Sure. Thank you so much. And now I am inviting Dr. Mariam Salcedo from Bolivia, please.
Thanks, ma'am. Distinguished Dr. Ismail Said, President Ifph, Dr. Shaji Kudiat, Vice President Ifph, Dr. Ganesh, Coordinator of Webinars, dear colleagues, distinguished guests, and members of Ifph. It's an honor and a privilege to be here today to express my sincere gratitude to International Forum for Promoting Homeopathy for its tireless dedication and inspiring all homeopaths to deepen their knowledge and for keeping us united recusing the fundamental values of homeopathy, especially during these challenging times we have faced as a global community. During COVID-19 pandemic, we have witnessed the resilience and solidarity demonstrated by homeopathic professionals around the world. At a time when uncertainty and fear prevailed, you as an organization have been a beacon of light and hope, reminding us the importance of remaining faithful to the principles of classical homeopathy. Throughout these difficult months, we have seen how homeopathy has played a significant role in supporting public health, from strengthening the immune system to relieving symptoms associated with stress and anxiety. Homeopathy has offered a comprehensive and holistic approach to wellness during the pandemic times. But what is even more remarkable is the role that homeopathy is playing now in the post-pandemic phase. The pandemic left a profound global and regional impact, the dimensions of which we are still fully understanding. 20% of cases are left with sequelae, which are classified as a long-term or prolonged COVID. A study carried out in United Kingdom and United States warned about the increased risk of developing dementia after having been infected with coronavirus, which is known as COVID-19. Cognitive decline was found to be almost twice as likely in COVID survivors as in uninfected ones. According to recent data from the Pan American Health Organization, it is estimated that approximately 30% of the population in Americas is experiencing some types of post-pandemic health alterations, ranging from persistent fatigue to sleep disorders and emotional imbalances. The reality is that we now face the epidemiological characteristics of COVID. First, it has no predictable pattern. 2, variants will continue to emerge. 3, existence of cases of prolonged COVID. And 4, the appearance of new vaccines. So now we are facing the consequences of the pandemic and the consequences of the vaccines. This is the time to spread homeopathy, knowing that is the only medicine that can save humanity. This figure reflects the complexity of the challenges we face in the recovery and rebuilding phase. However, homeopathy stands out as an invaluable tool in managing these post-pandemic health alterations. Its individualized approach and its ability to address both physical and emotional symptoms make it an effective and safe therapeutic option for those seeking support in this difficult time. Last but not least, I want to take this opportunity to congratulate the International Forum for Promoting Homeopathy on its 1,300 days of interrupted activities. Your dedication and commitment to promoting homeopathy have been truly inspiring, and we thank you for your continued work for the benefit of our community. I also would like to tell you that we have just concluded the second class of experts in homeopathy from Loyola University of Bolivia, a course in which you have been a great inspiration. On behalf of all the homeopaths present, I want to express our deepest gratitude for your leadership, support, and shared visions of a world where homeopathy occupies the prominent place it deserves. May success and collaboration continue in the days to come. Thank you and congratulations.
Thank you so much, Dr. Maria Salcedo. Now I am inviting Dr. Bob Lim from Malaysia. Dr. Bob Lim, are you there?
Oh, yeah. Okay, thank you. On behalf of the homeopathy physicians and supporters from Malaysia, I would like to congratulate the International Forum for Promoting Homeopathy, IFPH, for the successful 1,300 days of uninterrupted daily webinar. Homeopathy is a holistic medicine, as stated by Dr. Sadi just now, as it considers the physical, pathological, and mind emotional symptoms. This is a holistic medicine, the wholesome medicines that can solve our daily problems. And homeopathy can solve many health problems, be it acute or chronic. It is a school of thought which the Ministry of Health should consider in the normal mission in society to help the sick. In many countries, homeopathy complements that of allopathy medicine. All physicians have this normal mission, which is to heal or cure and bring patient back to health. And it is written in the aphorism 1 in the Organon of Medicine by the founder of homeopathy, Dr. Hahnemann. When certain big pharmaceutical companies started using mRNA to create a vaccine, it immediately creates many red flags in my mind. And the first thing I observed is that the mRNA vaccine has to be put in a cryogenic condition, which is in a liquid nitrogen. That is many degrees below freezing point. And the cells will be sleeping until it is warm up, then it becomes alive like that. I've studied that basics in college, where I've studied artificial insemination, where we collect sperms from the bulls and we put it into straw and put it in liquid nitrogen under cryogenic condition. And it is proven that this sperm cells will sleep until at the time when it is warm up at the body temperature, and it become alive back. You can observe it under the microscope 5 years, 10 years ago, that you keep it on this condition. So it already stirs a lot of red flag in my mind. See, and when we study about in college about the basic, right, virology, immunology. So when you inject something into your body, especially this live virus part, like this virus protein, it is going to, like, you are breaking all these our what they call the immune system point. You see, our body have the basic self-defense. The first line of defense is our nostril, our eyes, where the mucous membrane are, and the skin. That are the first line of defense. Yeah, and it comes to the throat and the tonsil. That's why when we have affected by a bacteria or virus, we have something like what we call condition called tonsillitis. The tonsil get inflamed because it is part of the immune system of our body. But when you inject a protein into the body, it is already crossed all the line of defense, like the enemy is going behind your headquarters, is behind you. So the body will come into a panic situation. So that is why this mRNA vaccine causes a lot of problems in society for those who have been vaccinated. And as we observe, because this immune system is going to deal with the enemy behind us, so they're going to surround the cells, the what do you call that, the RNA protein, and they're going to form something like a tumor. So it happens, and it creates something like an embolism. So it creates a lot of havoc in our body. So this is an experimental thing. It's not a real vaccine. See, it is very different from all conventional vaccine that we are doing for. Conventional vaccines, we have dead virus, which is not that dangerous. So as you can see from the post-COVID scenario, that the people, many people, normal people are dying from stroke and also suffering from tumor. Most cases appear at the present moment scenario here is a lot of patients have carcinoma, especially tumor of the breast. So those are the post-COVID scenario. So we cannot deny that because it is happening. So I'm sure the allopathy doctors also will discover that too. And recently, we have an article in Japan, the top scientists have petitioned to ban the RNA vaccine, which is considered toxic to the blood and to the system. And that's why they recommend not to use blood from the vaccinated people with those who vaccinated with mRNA vaccine. The blood cannot be used as a blood donation. So in short, let us not be in the comfort zone bounded by big pharmaceutical company in the battling of infectious disease and epidemic. Pandemic of the recent so-called novel virus COVID. The experimental action of using mRNA vaccine and the legislation to force the people to use that in place of conventional vaccine is not a good idea. In spite of a difference in the medical school of thought, the authorities concerned should leave no stone to work together with homeopathy, alternative medicine, TCM, in bettering and finding a cure for this pandemic and epidemic, reducing mortality rate and the sufferings of the people as a humanitarian mission. Let us be united in health, in spite of a difference, and be more open to each other. Thank you very much.
Thank you, sir. Thank you so much. Now I am inviting Dr. Anil Kumar, sir, for giving out of thanks. Sir, please. Dr. Anil Kumar.